Skincare for rosacea is another item that's been in the literature recently because we've sort of ignored it in the past. We've only recently come to recognize that rosacea is indeed a barrier repair deficient disorder. And the importance of repairing the barrier is quite evident. When you don't do that, rosacea gets worse. When you do it, you can actually make rosacea better even without medications. And lastly, rosacea medications often irritate the skin, and the use of good skincare first to repair the barrier will allow the patient to use the medication, which would work if they were actually able to use it. So it's crucially important that our rosacea patients understand good quality cleansers, very important, with low pH and low lather, low surfactant count, so that they're actually cleansing their skin without stripping it, followed by quality moisturizer that contains an emollient, a humectant, perhaps some physiologic lipids to help repair the barrier and to soothe the skin, and of course, finally, the importance of sunscreen. So the bottom line is that no visit for rosacea is finished until we've done a really good job teaching them quality skincare.